The main function of the endocrine system is to maintain homeostasis. The system regulates growth and development, reproduction, energy use, and electrolyte balance. Too little or too much glandular activity disrupts homeostasis, leads to various disorders, and interferes with the normal functioning of other endocrine glands. You will note that on page 576, figure 35.1 shows the sites of action for these agents. We will begin with the agonists, those drugs that increase the secretion of hormones. The first drug is leuprolide, and leuprolide is an anti-neoplastic agent used to treat prostate cancer. It can also be used for other things like endometriosis or precocious puberty that results from increased hypothalamic activity prior to the age that puberty is typically begun in an individual. Please look at the across the lifespan box on page 579 for more information about this drug. Note that agonists can cause sweating, hot flashes, stroke, MI, pulmonary embolism, peripheral edema, GI bleeding, or hepatotoxicity as an adverse effect. The drug is administered subcutaneously or IM, and individuals who begin treatment with leuprolide may have increased bone pain initially. This drug is very expensive, and that may impact the individual's ability to pay for the drug. Growth hormones, the example is somatropin. Growth hormone is responsible for linear skeletal growth. So you use this drug for long-term treatment of growth failure in children and for growth hormone deficiency in adults or with AIDS wasting. How would you know that the drug is effective, and when do you know to stop it? And that would be when on X-ray, the epithelial endings of the growth plates have fused and growth is no longer going to occur. The side effects are listed here. It is contraindicated if the epiphyses have closed, as I just said. That is the time you would say, hey, it's time to stop the drug. The patient may have some injection pain when it is initiated, and you need to teach them how to store and reconstitute the drug, and that will depend upon which company has supplied the drug, because they each have a little bit of difference in how they reconstitute the drug. You need to teach the patient also to rotate their injection sites. I've listed the common growth hormone conditions in the chart below. Let's talk about pituitary drugs. Our choice of pituitary drug to talk about is desmopressin, or DDAVP. You will find this on page 589, and you will find a critical thinking scenario on page 587 related to treating posterior pituitary disease of diabetes insipidus, with which you would treat with this drug. So you can also use the drug for hemophilia A. So please read that critical thinking scenario to have a better understanding of this drug. It can be given orally, it can be given intranasally or IV. If you give it intranasally, you need to switch sides of the nostril that you use every day to decrease the amount of irritation. Please look on page 587 at nasal spray administration, because you will probably have a test question related to how to administer and teach a client to administer nose spray. A problem with DDAVP is water intoxication with high doses of the drug. The patient will develop drowsiness, lightheadedness, headache, coma, and even can develop seizures if they develop water intoxication. So what happens and how this drug works is it enhances the reabsorption of water in the kidneys. With diabetes insipidus, the patient voids large amounts of urine and loses a lot of electrolytes in the process, and this drug is an analog of the naturally occurring vasopressin or antidiuretic hormone, and it helps reabsorb water to slow down the amount of electrolytes lost in the urine. Moving on to chapter 36. In chapter 36, we are going to talk about the steroids. Okay, on page 596 in figure 36.1, you will see the different controls of the adrenal gland and how it controls the hypothalamus and the pituitary gland. So you can look at that. But let's in general talk about steroids, and there are several classes. We're going to talk about glucocorticoids and mineralocorticoids. You will notice that in this right-hand column, the administration of all of these steroids will have the same miscellaneous information, and they all have the same side effects, which include central nervous system depression, euphoria, headache, some GI peptic ulcers. Decreased wound healing is a common problem with individuals who take steroids over a long period of time. Long-term use of steroids also causes adrenal suppression. It causes a Cushingoid appearance, which is moon face and a buffalo hump at the back. And you maybe remember seeing those examples in your health assessment book last semester. They can also cause patients to gain weight, and long-term use of any steroid can lead to osteoporosis and spontaneous fractures. So the bone breaks and then the patient falls. So dexamethasone and prednisone are both glucocorticoids, and prednisone also has a mineralocorticoid activity where it affects the potassium, sodium, and water levels, and that is where you get the weight gain, is from that water level change. In the mineralocorticosteroids, we use cortisone, and it acts directly on electrolyte levels to increase sodium and water retention and increase potassium excretion. So particularly with mineralocorticoids, you have to worry about the patient developing muscle cramps and signs that they have a low potassium level. It is used often for replacement therapy of adrenal insufficiency, but can be used for the other indications for short-term use in inflammatory disorders, etc. In box 36.1 on page 594 is a section. It's the little green box down there on diurnal rhythm, and it talks about the appropriate times of the day and methods of administration of steroids. You need to look at this, and you need to understand why the most important time for an individual to take a steroid would be early in the morning around 6 to 8 a.m. You may have a test question on that, and it may vary just a little bit. I would say 8 to 9 a.m. usually is what we have put here in our chart. So you need to understand that. You also need to understand that these drugs are very prone to causing patients to develop peptic ulcers and to have GI irritation, so you must give the drugs with food. You also must understand the tapering process. These drugs, because they work the way that they do, need to be tapered. You can't just discontinue them, or they will upset that entire adrenal cortex, the way the adrenal gland works. So they need to be tapered to be discontinued. So that would be something to teach your patient. And finally, the patient should be taught to avoid a live virus vaccine, such as the measles vaccine, because these drugs do cause the patient to be immunocompromised, and they tend to be more prone to infection and to delayed wound healing. So they should avoid a live virus, such as the measles vaccine, while they are taking a steroid drug. Looking on page 597, you will see that corticosteroid drug therapy across the lifespan. So please read through this so that you can understand how these drugs are used differently with individuals depending upon their age. And finally, on page 602 and 603, there is a critical thinking scenario that will further help you to understand how these drugs are used, what information you need to teach your patient, and how you would evaluate the effectiveness of these drugs. Thank you.